Could your sleeping habits be sabotaging your chiropractic care? Today I'd like to discuss both improper and proper sleeping habits so that you can get the most out of your chiropractic care. So first I'd like to discuss improper sleeping habits. Now the worst thing that we can do is sleep face down or on our stomach. But I will admit, as a chiropractor, I routinely ask my patients to lie face down on my adjusting tables. But there's two reasons for that. One is because it's easier for me as a chiropractor to feel their vertebrae and to adjust their vertebrae that way. The other reason is that my chiropractic adjusting tables, unlike your bed, have a face piece, so the patient has a place to put her nose without having to turn her head to one side or the other. The reasons that we shouldn't stomach sleep, well, there are actually three of them. First of all, we shouldn't stomach sleep because if we do, like I briefly alluded to earlier, you're going to have to turn your head to one side or the other because your bed doesn't have a face piece. So if you have to turn your head to the left side like this, it's going to put a lot of stress on the right side of your neck. It's going to create imbalances if we do that. So we're going to put a lot of stress on the right side of the neck. We're also going to put a lot of stress in this right shoulder area. And by doing so, we could actually be impinging nerves in our neck or in our shoulder. Another reason that we don't want to be a stomach sleeper is because mainly a lot of my female patients are worried about their tummy, that maybe it looks a little flabby. And so what we have found is some of the research has actually shown that if we're a stomach sleeper, it's going to cause us to have weaker abdominal muscles than if we slept in a more correct position. So that's something we want to avoid as well for stomach sleeping. Now, the last reason, the third and final reason that I tell my patients to not sleep on your stomach is because your heart and your lungs, your vital organs, live in the rib cage. And when you breathe, the rib cage needs to expand and contract so we can get the maximum amount of oxygen to those cells and tissues in the heart and lungs. So if you think about it, if you're sleeping on your stomach instead of a better sleeping posture, when you're inhaling, your rib cage can't expand all the way as if you were sleeping in a better posture. When you're exhaling, your rib cage can't contract all the way like it would if you were in a different posture. So bottom line is you're not getting as much oxygen to the heart and to the lungs, your vital organs. So those are the three really good reasons that you should not be sleeping on your stomach. So how should you sleep, you might be asking? Well, we have three options for you. You can sleep on your back, you can sleep on your right side, or you can sleep on your left side. Now you wouldn't believe the number of times I've had a new patient come into me and they say something along the lines of, "Oh doctor, I've only got one way of sleeping. It's been like that for years. I can only sleep on my right side. But the last couple weeks I've had a right shoulder problem and I can't get any sleep at all." Well, that's unfortunate. And that's one of the reasons that we want to have more than one option for sleeping so that we don't have to come across an example like that. So one thing that I preach to my patients is about balance. We don't want to stress the structures or the muscles or ligaments on one side of the body all the time and never stress the structures on the other side of the body. So for example, if a patient came in and told me he's going to go home and shovel snow for 30 minutes, well, what I would tell him is we're going to shovel snow 15 minutes in this direction and we're going to turn around and do it for 15 minutes in this direction. That way we're not creating major imbalances. And the same thing with our sleeping. So we should sleep in more than one position, not just one position all the time. Now, another thing I'd like to talk about is what we call a chiropractic pillow. So many chiropractors carry these in their office. It's called a chiropractic pillow. You might also hear it called a cervical pillow or a neck pillow. So they're all the same thing. But a chiropractic pillow has a raised up part on either side to help support your neck and a hollowed out part here in the middle for your head. So when we're looking at a cervical pillow, if we're sleeping on our back, it's going to keep our neck in proper alignment here with a normal forward curve in it. Versus if we're sleeping on a big fat hotel pillow, it's not doing that, trust me. So it's going to help keep a normal forward curve in there. Now if we're sleeping on our side on the cervical pillow, it's going to keep our neck vertebrae in alignment with the rest of our vertebrae in our back. So that's why we'd recommend using a cervical pillow. So definitely talk to your chiropractor about how you can get a chiropractic cervical pillow to help with your adjustments. Now the next thing I'd like to discuss briefly is that cervical curve that I alluded to earlier. We should have a normal forward curve in our neck. So for example, if I'm standing here facing this way, I should have a curve like this. But what happens is a lot of patients come in, sometimes they've been in an auto accident in the past, sometimes they've had an old sports injury, and what happens is their neck healed like this, straight. We call that a military neck because it's standing at attention. And so what happens is they have lost that normal cervical curve. And chiropractic is going to help with that, neck adjustments, but we've also found that over time, one of the best things for that is using one of those cervical pillows because it can help to bring that curve back towards normal. So as far as what I've found in my 17 years of practicing as a chiropractor is that most every patient that's come to me with a neck problem, an upper back problem, headaches, sinus issues, shoulder problems, arm problems, or hand problems can typically benefit from using a chiropractic pillow. Now, as far as the 3 sleeping positions, I'd like to just give you a little more detail on exactly how to go about doing those. One would be sleep on your back with the cervical pillow like we just talked about, but you also want to bring your knees up, take an extra pillow, just a normal pillow, fold it in half, and stick it under your knees. Now by doing so, you're going to help to take stress off of the low back, buttock, hip area, or sciatic area as well. If you're going to sleep on your right side or your left side, once again, you want to lay on your side on your cervical or chiropractic pillow. Then you want to take that extra pillow, don't fold it in half this time, just leave it flat. Bring your knees out in front in what we call a modified fetal position and stick that extra pillow right between your knees. Once again, that's going to help take stress off the lower back area if you're sleeping on your side. Now, before I close, I'd like to share my personal story with you. I used to be a stomach sleeper. I refer to myself as a reformed stomach sleeper. When I initially went to a chiropractor 21 years ago, I had a lot of sinus problems, and they were chronic. And he told me, we're going to have to adjust your neck because we found 2 pinched nerves in my neck, 2 subluxations. So he also said, and we're going to do one other thing here. We're going to have you sleep on a chiropractic pillow. I said, you don't understand, Doc. I'm a stomach sleeper. That doesn't look like it'd be comfortable for me. And he said, no, you don't understand. If you want to get rid of these sinus problems, you need to do what I say. So I went ahead and bought a chiropractic pillow, and it was one of the best decisions I've ever made in my life because within 3 nights, I was sleeping much better. Within 2.5 weeks, my sinus problems were really a thing of the past. So it was pretty amazing. So it makes good sense to use a chiropractic pillow to help support your adjustments and to keep you in a better sleeping posture. Because keep in mind, if you're going to spend 6 to 8 hours every night in bed, it's best to not be sabotaging what your chiropractor is trying to accomplish while you're here in the office. If you want to know more about these chiropractic pillows, more about correct sleeping postures, if you have any questions, please feel free to discuss this with your doctor of chiropractic. And have a good night's rest.